Hi, today I'm going to talk about coercion and clinical task number 1. So, first of all, what is coercion? Coercion is taking measures against the patient's wishes or in spite of their opposition. For example, a patient who is scared of injections needs to get injected and he refuses to do so, but the nurse forcibly gives him an injection. This may lead to rupture in their therapeutic relationship and risk of trauma or shock. Clinical task number 1. Mrs. Grigorova is a 43-year-old patient who was in an accident in which she fractured her pelvis, right femur and right forearm. She formerly lived alone in an apartment and looked in on her elderly mother at the assisted living facility daily. After a long hospitalization, doctors plan to discharge Mrs. Grigorova. She cannot ambulate, walk and has difficulty feeding herself with her left hand. Consider how Mrs. Grigorova will move through the healthcare system to regain her self-care ability. Mrs. Grigorova cannot feed herself or ambulate. What kind of assistance will she need after discharge? Mrs. Grigorova will need assistance in walking and feeding, which would most likely be provided by home healthcare service or by her family members. Question number 2. Can she be discharged to her apartment living alone? Explain your answer. Mrs. Grigorova cannot feed by herself and walk by herself, so it would not be possible for her to live alone. That is why she would most likely need someone to help her or assist her with walking and feeding. Question number 3. List the locations in which her continuing care would be provided. Her continuing care would be provided by home healthcare services or by the nursing homes or most likely by the family members who would assist her in eating and walking.